The European Cancer Organization is calling for action on the treatment of cancers caused by HPV and to improve the public and health professional awareness on the virus and how can it be eliminated. First, let's take a look at treatment. It cannot be right that women diagnosed with cervical cancer, 5-year survival rates range from 80% in, for instance, Iceland to 55% in Poland and Bulgaria. The same variation also exists for other cancers caused by HPV. There are now consensus guidelines for the treatment of all these cancers. And if these were followed by health professionals, they would lead to improve to a more equitable outcome, both within and across European countries. We are now therefore calling for all cancer plans across Europe to include actions to implement the best practice guidelines. And for cervical cancer specifically, we think that by the year 2030, a minimum of 90% of women with grade 3 pre-cancer should be treated within 3 months, and a minimum of 90% of all invasive cancer should have been detected and managed. We face now, and I would like to call your attention for this, a major challenge from fake news. You know, science and science-based health care should be our motive, our focus. And fake news, most often spread by social media, have in recent years undermined public confidence in vaccination in general and specifically in HPV vaccination. We now know from repeated studies of hundreds of thousands of people that HPV vaccine is safe and that any adverse reaction are minor and short-term. But anti-vaccination rumors have undermined programs around the world, and in Denmark, for instance, unproven allegations of safety concerns about the HPV vaccines led to a fall in uptake of vaccine by girls from 90% to 55%. This will tragically lead to an increase in cervical precancers and invasive cancers. But this can be turned around. In Ireland, for instance, the work of the HPV Vaccination Alliance has shown how a coalition of NGOs, health agencies, and professionals can work together to restore public confidence in the HPV vaccination. In Portugal, more than 90% of women are vaccinated due to the confidence of the National Health Program. We are therefore calling for all European country council plans to include actions to increase public understanding and awareness of HPV, and we also want social media platforms to take more action to reduce the spread of fake news on vaccination. Because health professionals, doctors, nurses, dentists, pharmacists, and others have a key role in building vaccine confidence among the population, we also want to see better education programs for this health workforce. The effort to build confidence in vaccines is particularly important during the COVID-19 pandemic to help ensure that any vaccine is widely used. In conclusion, we now have the means to eliminate around 87,000 cancer cases caused by HPV each year across Europe. We can, at the same time, eliminate other diseases caused by HPV, genital warts and recurrent respiratory papillomatosis, a very disabling breathing condition that affects both children and adults. The price is great, but it is totally achieved with vision, ambition, and commitment. The European Cancer Organization new report, Viral Protection Achieving the Possible, shows the way. We can, through a combination of vaccinations, screening, treatment, and greater awareness, tackle the misery, suffering, and deaths caused by HPV. We need your confidence.